Hello friends, this is Sonu and today we'll continue the rest of the topic that we discussed in the last session about the hypnotic and sedative. So right now we'll discuss about the barbiturate. But before the start about the barbiturate, some information I would like to say that as we know that the main drug of the choice for the hypnotic and sedative, this is the benzodiazepine and the barbiturate and some other miscellaneous drug. But barbiturate nowadays we don't use. We use mostly the benzodiazepine instead of the barbiturate. What is the main reason? Reason is that actually the barbiturate it's a very highly the depressive of the neuron, or we can say the excitement of the neuron very fastly. It's decrease the excitement of the neuron, and it's a very potent enzyme inducer. And then it's also effect on the medullary area. Medullary paralysis means if you increase the amount of the barbiturate, it can be depress the medullary area, and it can lead to the respiratory failure and the heart failure. And these effects are not seen in the benzodiazepine. That's why nowadays the good drug of the choice for the hypnotic and sedative, this is the benzodiazepine. Some of the drug of the barbiturate group are still used, like the phenobarbital, thiopentane sodium, methoxyhexitone. This is the thiopentane sodium and methoxyhexitone. This is the general anesthetic drug from the general anesthesia, you can remember. And some other difference also. About the main difference we will discuss later. So let's start about the barbiturate. First of all, you can see the main classification: the long acting, short acting, and the ultra short acting. Long acting, it's a less lipid soluble. Short acting, moderate lipid soluble, and the highly lipid soluble, ultra short acting. That's why it's a very short acting and very high action. So in a long acting we have phenobarbital. In the short acting, pentobarbital and butobarbital. And the ultra short acting, that is the thiopentane sodium and methoxyhexitone. This is the mainly the general anesthetic drug, but it's belong for a group of the barbiturate, derivative of the barbiturate. That's why we should know about this. So first let's start about the pharmacokinetic. Pharmacokinetic. As we know that it's a lipid soluble, it means it's a very good absorb in a GIT. So well oral absorption. Can be used intravenous also, because in the general anesthetic, that is the thiopentane sodium, can be used by the general intravenous. And as we know that all drug is metabolized in a liver and kidney. So the same this drug also metabolized from the liver and the kidney, but metabolized by liver and excrete finally in kidney. But as we know that, as I said, that it's an enzyme inducer. So it's increase the enzyme, that is the very important enzyme, cytochrome P450. This enzyme, a lot of drugs are metabolized by this enzyme. Those drugs, for example, warfarin, that is the anticoagulating drug and the antidote of the vitamin K. Then steroid, very popular drug, a steroid called glutamide, that is the oral hypoglycemic drug used in a diabetes patient. And theophylline, some other antibiotic group like chloramphenicol, and so on. So this drug mainly metabolized by the cytochrome 450. And as we know that barbiturate are inducing this enzyme, means whenever you giving the both drug in the same time, means this enzyme is increasing by the barbiturate, and this drug is fastly metabolized by this enzyme. Means the action of this drug become very less, and sometimes you can't see any action due to the metabolize of very fastly metabolize of this enzyme. And this enzyme are very rich amount due to the barbiturate are inducing this enzyme. That's why you should know that we can't use the both drug in the same time. If you use, then you can't see any action, and very low action you can see because of the very fast metabolism that this enzyme, and this enzyme increase due to the barbiturate. That's what a very important information that you should know, that this inducing this enzyme. And due to the lipid solubility, this drug can also penetrate the placental barrier. Means the fetus become depressed. That's why it's absolutely contraindication for the pregnant lady. So it can cross the placenta, and it can also appear in the milk. Means those lady who are breastfeeding of the baby should be avoided also. So can be appear in mother milk. That's why should avoid also. So well absorbed due to the lipid solubility. Intravenous can be used, metabolized by the liver and excreted by the kidney. Induce this enzyme, increase the amount of this enzyme, concentration of this enzyme cytochrome 450, and that's why this drug is a very fastly metabolized and can decrease the drug efficacy, decrease the drug action due to the increase this enzyme. It can cross the placental barrier, so baby become like the fetus become depressed. That's why absolutely contraindication for the pregnant lady, and can be appear in the mother milk. That's why the feeding those mother who feeding the baby should be avoid this drug. So I think this is the main important information about the pharmacokinetic. Now we'll discuss about pharmacological effect. What could be the pharmacological effect? So before the start pharmacological effect, one thing that you should know, it is a dose dependent drug. Means if you increase the dose, you can change the different types of effect. So dose dependent. Like in a normal dose can be sedative action. If you increase the dose, hypnotic action. Then if you increase the dose, you can see general anesthesia can be, and then coma, and finally can be death. Because it's depress the medullary area and the failure of the respiratory center, failure of the heart rate, and patient can be die. That's why it's dose dependent. It's dependent upon the dose. If you increase the dose, you can see hypnotic action, general anesthesia can be coma, and finally can be death. So now pharmacological effect. Effect. Actually, it's a depress the all over the CNS, all over the excitable neuron, but most sensitive area, this is the reticular formation, which is maintained over the sleep conditions. So it depress the all CNS. but most sensitive reticular formation, that is the maintain our sleepiness. So what could we change in CNS? It's decrease the excitement, increase the sleep time, and impair memory, impaired the mental function, decrease the short term memory, or we can say interrupt the short term memory, and its tolerance and dependence can be occur if repeated use. Means in repeated use it can repeated use can accumulate drug, accumulate, and then tolerance and dependence can be there. Then withdrawal syndrome also. Withdrawal syndrome means like if the person suddenly stop the taking the barbiturate, can be delirium, hallucinations, excitement, tremor. This effect can be there. That is called the withdrawal syndrome. Repeated use can be accumulate and tolerance dependence can be there. Short term memory can be lost, impairment of the mental functions, and increase the sleep time, decrease the excitement, and it can also change in the sleep cycle, that is the decrease the REM, that is rapid eye movement. So decrease the REM cycle, and the stage 2 and stage 3 interruption of this stage also. This is the normal sleep cycle. So this is the main pharmacological effect you can see in the CNS. And sometimes also you can see that if the person is prolonged use, like the last 3 months and 4 months they're taking the barbiturate, so on the morning, on the when they awake from the like in the morning, they can like the unpleasant mind, unpleasant feel, headache. This type effect can be see. And the barbiturate don't have any analgesic action. Even in a normal dose, the hyperalgesia can be seen. Hyperalgesia means no any analgesic action, and even normal dose pain can be stimulated. So this thing you should know. So this is the about main effect in a CNS. And heart and respiratory, as I said, that is depend upon the dose. So in a normal dose, no any significant change in the heart and the respiratory, but in a high dose can be decrease the heart rate and can be decrease the respiratory rate. So hypoxia can be developed due to the decreased respiration. So this change can be there. And in kidney, you can see that due to in a high dose, in a normal dose you can't see anything, but in a high dose, because due to decrease the heart rate, so urine output become decreased. First due to the decreased BP, and second it's an increased antidiuretic hormone. And as we know that antidiuretic hormone is the water absorption, is the function of the antidiuretic hormone, absorb the water in the last part of the kidney. That's why first reason, decrease the BP due to urine output decrease. Second, increase the ADS. That's why urine output also too much decrease. So finally, oliguria can be happen. Oliguria can be occur in a kidney. And about the muscles, also relaxed whenever you apply the increased amount of the drug dose. So this effect can be seen. So this is the main pharmacological effect of the barbiturate. About the mechanism of action, we discussed already details in the last session, but briefly we'll discuss again. Mechanism of action. First of all, as I said, that it's a act on the GABA receptor, that is the GABA neurotransmitter, that is our inhibitory neurotransmitter. So it act on the GABA, increase the GABA concentration. Then it's a GABA mimetic action. GABA mimetic means in a high dose, if you apply in a high dose, like in a normal brain, the normal concentration of the GABA is there due to the maintain the excitation and the inhibition of the brain functions. So the normal GABA is a mimetic of the normal GABA concentration in the brain. That's the GABA mimetic. Then also it's act on the alpha and the beta subgroup of the GABA receptor, and in a high amount it can also block the or suppress the glutamate, that is our excitatory neurotransmitter, glutamate. Then it also suppress the calcium dependent neuron, and in some cases, yeah, you can see that sodium potassium channel can be suppressed, can be interrupted or suppressed, but in a high dose. In normal dose you just see, and also in high dose can open directly chlorine channel, that can be hyperchloride of the neuron cell. So this is the brief, you can say, mechanism of action, that in a normal amount, in a normal dose, just is to increase the GABA concentration to bind the alpha and beta subunit and influx the chlorine inside the neuron. And then it's if you like in high dose, it can mimic the GABA action, suppress the glutamate, that is the excitatory neurotransmitter, suppress the calcium dependent neuron, and sodium potassium channel can also be suppressed, decrease the sodium potassium channel, and open the direct, it can open direct chlorine channel in a high dose. So this is the main mechanism of action. Now we discuss about main indication. As I said that we don't use nowadays barbiturate, but in some cases, in some critical condition that you don't have any option except barbiturate drug, on the time you can use, but you have to remember about the dose, very few dose, very less dose you have to apply. First, anti-convulsion. Because it's relax the muscles in a high dose. So anticonvulsants like epilepsy and tetanus. Then in neonatal jaundice, like it's increase the gluconol transferase enzyme, that the deficiency of that enzyme that lead to the neonatal jaundice. So this drug is the increased gluconol Nile transferase. Increase this enzyme. By the help of this enzyme, can be relieve the neonatal jaundice. Then, as a general anesthesia, as I said, can be used. And I think this is the main indications: anticonvulsants, neonatal, and in narcoanalysis means in a criminal sessions, as a narcoanalysis can be used the barbiturate. So I think this is the main we can say indications as a anticonvulsants, anti-epileptic, neonatal jaundice, because it increase the glucose transferase, as a general anesthesia, and in narcoanalysis. This is the main indications about the barbiturate. About the side effect, the most side effect, it's a hangover mostly when awake in the morning. So hangover is the most side effects. Then the lack of memory, in a high dose blood pressure can be decreased, urine output can be decreased, but in a high dose. And sometimes hallucinations can be occur. Then lack of alertness, unpleasant mind can be happen. So, and some other CNS effect can be there. It's depend upon the dose and depend upon the person that they're taking in a first time or they're taking regularly. It's depend upon the persons and the dose. So this is the main we can say side effects. But side effects can be there if increase the dose. But in normal dose, the urine output and the lack of alertness is there. But blood pressure, respiratory rate, and urine output, you can't like no any significant change. So side effect is there. About the contraindication. In a contraindication, first of all, the pulmonary insufficiency, or we can say emphysema. Then cardiac pathology, and the idiosyncratic patient, idiosyncratic means the any persons whose genetic disorder of the enzyme on those persons should be contraindication, like in acute intermittent porphyria, acute intermittent porphyria, this is the disease genetic disorder which inability to the synthesis of the heme, and because heme is the carry the oxygen, so this is the genetic disorder. So in these conditions should be contraindication barbiturate, means the idiosyncratic patients. Then on those patients that you suspect that it's a very depressive patient and it can be by the help of this drug can be suicide also. So the suicidal condition means the person has become too depressed, they're living in a too much depression, and whenever they take the barbiturate, the scene has become too much depressed. Means the neuron excitability of the neuron is depressed, and the person can be suicide. So suicidal conditions should be a contraindication, and also hypersensitivity. Hypersensitivity. These are the main contraindications. And also don't forget about hepatic insufficiency, kidney pathology, and hepatic insufficiency and kidney pathology. A lot of drug can be contraindication, because the main metabolic organ metabolize or detoxify the drug toxicity. So about side effects, contraindication, you can see. Now we'll discuss about the barbiturate poisoning. One reason also to avoid the barbiturate nowadays, because about the barbiturate we don't have any specific antidote, but benzodiazepine we have a specific antidote, that is the flumazil. That's why benzodiazepine also good drug nowadays as a sedative and hypnotic. So barbiturate poisoning. First of all, what you have to start in a barbiturate poisoning? First, you should give gastric lavage. Gastric lavage, it is the suspension of the activated charcoal, that is the decrease the absorption in the intestine, prevent the absorption of the intestine. So gastric lavage first, then oxygen therapy, because poisoning means the person is take too much barbiturate, and as we know that if increase the barbiturate, it can suppress the medullary paralysis, and medullary paralysis means decrease the respiration rate, decrease the heart rate. That's why the person is in a hypoxic conditions, so oxygen should be give. Then ventilation, means in an open area that fresh air is come on that area should be keep the person. And alkaline diuresis, means if you give the alkaline medium water or alkaline medium any drug, alkaline medium can be forcefully excrete the barbiturate from the blood. So alkaline diuresis can be helpful. And hemodialysis means loop diuretic can be helpful for the barbiturate poisoning, but we don't have any specific drug that can be you apply the antidote and the person becomes safe. This is the, we can say, for prevention of the barbiturate poisoning, but it depends upon the dose. If the person is take the too much dose, so this drug can't help also. That's why due to this reason also we don't use the barbiturate all drugs. Some of the drug used like the phenobarbital as anti-epileptic and the thiopentane sodium as a general anesthetic, but also combination with other anesthetic drug. We can't use alone due to the don't have any analgesic properties. So I think this is the main information about the barbiturate. In the next session we will discuss benzodiazepine and some other miscellaneous drug, and we'll discuss about main difference between barbiturate and the benzodiazepine. Why the benzodiazepine is good drug, why the barbiturate is not good, about this thing. So thank you, hope you will like the barbiturate, and next video will discuss very soon. Thank you so much.